Hi, this is Irene Owens again, and welcome to week 2. You made it through week 1, and we're very proud of you. Today we're going to be in Chapter 5, Wilkinson, Nursing Process. We're going to talk a little bit about planning and our client outcomes, and how come those are really important. So you ask, what is planning? Well, we plan all the time, whether it's formal or informal. Formally planning is what you're going to be doing a lot as a student, and you do a lot of informal planning as you make mental notes or you make any kind of plans as you go in and observe and assess patients. Formal planning is where we do a conscious, deliberate activity involving decision making, critical thinking, and creativity as we go along. A lot of times in nursing, we'll do that informal planning when we just we go in and we're doing our first assessment for the day, and we note that this patient is in pain. So that's a mental note that we make, and we know that we need to check to see when the last pain medication was. We need to assess what type of pain, where the pain is, on a scale of 0 to 10, what is the pain? Is it chronic pain? Is it acute pain? Is it post-op pain? What type of pain is it? So a lot of times those are mental notes that we may not put down formally, but there's something that we do every day in our practice. Our initial and ongoing planning. Our initial planning begins with the first client contact, the very first time that you meet the patient. And it refers to the development of that initial comprehensive care plan, which should be written as soon as possible, after initial assessment. We also develop the initial comprehensive care plan as we go, making sure that we do the assessment, we do the nursing diagnoses, and then we start to plan for our outcomes and our interventions. Our ongoing plan may, these are changes that are made as you evaluate the client's responses to care, such as, we go in, a patient's admitted with pneumonia, and we give bronchodilators, and then we do the before and after assessment of that patient. What do those breath sounds were like before the bronchodilator treatment? What were they after? After we even put the head of the bed up, did we have a good response? Did the patient's respiratory rate go down, or was the patient more comfortable? Discharge planning, as all of you should know, and if you don't, it's important that you do know. This is basically planning for self-care, and it's the process for that plan and continuity of care after the patient leaves that healthcare setting. So that begins the day that the patient is admitted. It begins with that very first initial assessment. And all clients need discharge planning, and it requires a collaboration because we don't live on an island all by ourselves. So we look at their physical condition, functional and self-care limitations. We look at emotional stability, their ability to learn, financial resources, family or other caregivers available, caregiving responsibilities that the patient may have, for others, especially if they're young, environment, both home and community, if there's any stairs, supplies, equipment that's needed, and any use of community services before admission and before that discharge. So it begins with initial assessment, and all clients need discharge planning, and it requires a community. It requires collaboration with a lot of different disciplines. So nursing care plans. Nursing care plans are the comprehensive, is a central source of information needed to basically guide our goal-oriented care. And it addresses each client's unique needs and perspectives. So you may ask, why is a written nursing care plan important? Well, it benefits the patient, which that's our ultimate goal, and it benefits the healthcare institution How does it do that? By ensuring that care is complete. Can you imagine if I had, when I was getting ready to teach the class, if we hadn't done all the preliminary work, we hadn't written down the goals for you, the outcomes for you as a student? It's almost like on the same level as that. So we need to make sure, I need to make sure as an instructor, that your teaching is adequate, your teaching is fair, your teaching and your learning is organized. So it's the same thing as a written nursing care plan. It ensures that care is going to be complete for the patient. Such as there's a lot of different, your book gives an explanation on page 84. If specific directions are written, such as turn that patient every hour, they're less likely to be, overlooked by your caregivers. So that's a good example of that. Provides continuity of care. This helps ensure that when an effective intervention is found, all caregivers will use the same approach with the patient. Not all approaches are the same, and if you find something that the patient is responding to, then we need to provide that continuity of care. It also promotes efficient use of nursing efforts. They don't waste any time on any type of ineffective approaches. And it also provides a guide for assessing and charting the nursing orders and goals that are expected on the care plan. Can help you recall what occurred and maybe what ensured that nothing is omitted from your documentation. It also meets the requirements of accrediting agencies. Very, very important. The Joint Commission, professional standards, all require a specific care. And they're different at different agencies. Your book goes over different types of care plans, critical pathways, standards of care, protocols, policies, and procedures that you can review on your own. Those are on page 86 and 87. So what kind of information do we need to put in a comprehensive nursing care plan? Well, they need the basic needs and activities of daily living, medical or multidisciplinary treatment, nursing diagnosis, collaborative problems, and any special discharge needs or teaching. It's very important. There are some what they call pre-printed or standardized plans that a lot of agencies or hospitals, facilities will use. And these are just basic general guides to describe the care the nurses are expected to provide for all clients in defined situations. So you may have seen some of those pre-printed standardized care forms. Detailed nursing care for particular nursing diagnosis, for all nursing diagnoses that commonly occur with a certain medical condition. It doesn't mean that you cannot individualize these standards of care, but it's real important that you go back to the standard of care and see what has been written so that you can follow that standard of care. There's also what they call a critical pathway, and on page in Wilkinson, Volume 1, Chapter 5, on page 88 and 89, there's a plan of care from the Genesis Medical Center in Iowa, and then there's also a critical pathway for a patient with a lower joint, hip, or knee repair. So it gives you some clinical keys about this patient, the expected, their outcomes for that patient, the treatments for day 1, day 2, post-op day 1, 2, and 3, and they basically want them to go home by day 4. So that kind of gives you an idea if you've never seen a critical pathway. And those are based on interdisciplinary plans that sequence the client care. And it's always based on a certain case type, such as this one is for hip and knee. This is just a schematic, and it's hard to read the slide, but it is on page 89 in Wilkinson. This just goes over some other integrated plans of care, and basically they're just standardized plans to be both care plan and a documentation form. And you can see that on page 88 in your chapter. I think when you use standardized nursing care plans, you always have to think about the individualized nursing care plan, which is used to address nursing diagnosis that's unique to that special client, because they are not all the same. So when you do your nursing care plan, if your patient outcomes are always the same for every single patient, I'm going to question you on, what is the special need of that patient as compared with your other patient, because we're not all standardized people. Special discharge or teaching plan, you may use a standardized plan for discharge planning and teaching, or include as teaching in a nursing diagnosis care plan. So there are some special ones, especially for discharge, teaching, sometimes nutrition, those types of plans you may see. You also will see computerized care plans, and that's what we have at Leesburg Regional Medical Center. You enter the diagnosis or the desired outcome. The computer generates that list of suggested interventions, and you use appropriate interventions as they apply. And you can individualize that plan of care by putting in your own interventions, as needed for the client. So the question is, we basically want to look at how do we write. This is the process basically for writing an individualized nursing care plan. And this is on page 91 in your book. I was kind of flipping through so I could find it for you. It's page 91 in your book if you're following me along. First of all, you need to make a working problem list. You need to decide which problems can be managed with a standardized care plan, or if it is a critical pathway that you can use, especially if it is standardized and it is one of those that will work on the unit that you're working on. And individualize the standardized plan as needed, and transcribe the medical orders to appropriate documentations. So we want to make sure that we look at, we want to individualize, we want to transcribe, we want those written ADLs and basic care needs, in either the computer or the care plan itself, and then make sure that you develop some problems that are not just a standardized form. So under our planning clients' goals and outcomes, I think you just need to go back to the definitions that are on page 91. A goal is also called an expected outcome, desired outcome, or predicted outcome. Your book goes in great depth about what the difference is, what do the terms goal and outcome mean, and that's on page 92. Many nurses use the terms goal and outcome interchangeably. It really doesn't matter to me when you're making up your nursing care plan, because if you look at the example on page 92, the first one, it says the outcome, we want this patient to have decision-making skills. So our goals or expected outcomes, the patient participates in decisions about their own care. They can choose between two or more alternatives as they're deciding. So when we look back at the definitions, it's what do we want our patient or our client to change in his behavior, his health behavior, that he can achieve the outcome that he has, that you have for him as you have collaborated with and others in the healthcare setting. So there's long-term goals and there's short-term goals. And usually long-term goals are to be achieved over a longer period of time, week, month, or more. There are short-term goals are to be achieved within a few hours or a few days. It's really the short-term goals that we're looking at when you and I are doing our care on the floor. We're looking at short-term goals. We're only there one day, so. Okay, this is a little clicker check, and you know this is a question, so I want you to identify the long-term goal. A, the client's pulse oxygenation level will be greater than 92% on room air by tomorrow. B, the client will administer his own insulin using correct technique by discharge. C, client's pressure ulcer will show presence of granulation tissue in 30 days. Or D, client's urine output will be 400 mLs per hour per 8-hour shift within 72 hours. So remember, this is a long-term goal problem outcome statement. And the answer is C. A long-term goal indicates that the resolution to a problem is expected to occur over weeks to months or more. So hopefully you got that right. So what are the components of a goal statement? So when we look at this, we are looking at the subject, which is the patient. The patient will. Whatever the action is, the performance criteria, and the target time and the special conditions that you're going to be looking at when you state your goal. And if you go back up to this other slide, look at slide 20 with our clicker check. The client, that's the subject. The action will be greater than. Performance criteria on room air, and our target time. It's by tomorrow. Okay, so and look, if you look at B, client, that's the subject. What is he going to do? He's going to administer his own insulin. Performance criteria is using correct technique, and the target time is by discharge. If you look at C, client's pressure ulcer will show presence of granulation tissue in 30 days. Client, action, his pressure ulcer will show presence of granulation. That's granulation will be the performance criteria, and in 30 days is our target time. Okay, same as for D, but I wanted to give you some examples of those. So if we go back to slide 22, what are the components of a goal statement? Remember the subject, the action, performance criteria, the target time, and the special conditions, if any. So how do our goals relate to nursing diagnoses? Expected outcomes derive directly from the nursing diagnosis. Our problem statement describes the response or the health status that needs to be changed, and the desired outcome states the opposite of the problem response. And there'll be many examples of this in your book as well. So on our goals, for every nursing diagnosis that we state after we have assessed our patient, you must state one goal that, if achieved, would demonstrate resolution or improvement of that problem. So if we had let me give you an example. For example, if we had a nursing diagnosis of, let me see, impaired physical mobility. So, and you gathered all the data from your patient because they had hip surgery and their post-op day number 1. So you've had the assessment done, the patient's to get up today. So one of the goals you have for your patient may be client will, because that's the subject, client will be able to ambulate at least 5 feet with the help of a walker and the assistance of a physical therapist. That's the performance criteria, with on a scale of less than 8 by 12 noon today. So that would be an excellent goal for that patient for that nursing diagnosis. And I've incorporated all of the components of a goal statement in that. So when we reflect critically about expected outcomes or goals for each nursing diagnosis, we have to ask ourselves, is there at least one goal that when met would demonstrate problem resolution? And are the predicted outcomes adequate to completely address the nursing diagnosis? So those are things you can ask yourself as you view your patient and as you talk to your patient, because the goals are not just your goals, they're the patient goals, they're the family goals. So we have to incorporate them as we go through our planning stage, as well as all stages of the nursing process. We also want to critically reflect critically about expected outcomes and goals and ask, is each expected outcome appropriate for the nursing diagnosis? Is it derived from only one nursing diagnosis? Is it descriptive of only one client or response behavior? And is it stated as a client behavior and not a nursing activity? Very important. It has to be stated as a client behavior. Always the subject is the client. Is each expected outcome stated in positive terms? Is it measurable or observable, given specific and concrete performance criteria? Just go back and look at the example or listen to the example I gave you, and that's what your outcomes and goals should be stated as. Does each goal or outcome include all the necessary parts? Is each outcome goal realistic and achievable? Because if it's not, we see your patients, we're with your patients. So when you write us a nursing care plan about your patient and we know that it's not a realistic goal, we're going to let you know. Does it not conflict with the medical or other collaborative treatment plan? Very important. So on our clicker check, we're going to identify it. It says, identify the client or outcome goal that is written correctly. A, the client's urine output will be adequate by the end of the shift. B, the client's pneumonia will be resolved as evidenced by clear breath sounds bilaterally by discharge. C, the client will ambulate 20 feet in the hallway using his walker by evening shift tomorrow. Or D, the client will drink more fluids than he did yesterday by 7 p.m. today. And hopefully you got the answer right, and you see the difference between the answer, of course, is C, and this statement meets all of the criteria for a correctly written client outcome. Adequate is not measurable. Clear breath sounds only would not be evidence of the resolution of pneumonia, and this is the medical diagnosis. More fluids than yesterday is vague and it is unclear. We also have to critically think when we continue to think about our expected outcomes or goals, does the client, family, or community value that outcome? That's very important because it's not your outcome, it's your patient's outcome. And if they don't value it, and if they don't think it's important, then it's not going to happen. And does the goal conflict with any religious or cultural values? Always a question that you need to ask yourself. So, critically thinking, just going to leave you with this thought. Suppose a nurse sees one of your student care plans and says to you, you're wasting your time writing those things. We never use the nursing process in the real world. And after this, after reading Chapter 5, after reading about the nursing process and knowing that our agencies expect us to do nursing care plans, they also are required by JCO. Remember, they're required by JCO. They're in our computerized care plans. I would have to question this nurse and see how she organizes and handles her patients every single day. So this is the end of Chapter 5, which is Part 4, the planning outcomes, and I'll talk to you later.